Good morning, everyone. Myself, Dr. Pankaj, and welcome to Pedia Academy of Pediatrics. We have discussed the many important topics for NEET SS exam, pediatric exam. Today, we are discussing the causes of neonatal cholestasis. We have discussed how to approach neonatal cholestasis case. Today, we'll discuss important cause of this Alagille syndrome, which is very important for clinical point of view as well as exam point of view. Okay, so we will discuss this. So, Alagille syndrome is, by definition, a multi-system autosomal dominant disorder. This is important. This is autosomal dominant, involving hepatic, ophthalmological, cardiac, skeletal, renal, vascular systems. Basically, you have to remember this is autosomal dominant, and it involves almost all systems. But what are the key features? Features are very important. Hepatic, paucity of intrahepatic bile duct leading to cholestasis, which is that's why we are discussing this syndrome under heading of neonatal cholestasis. Ophthalmological, posterior embryotoxin. We'll discuss later what is embryotoxin is, but this is posterior important. Cardiac, peripheral pulmonary stenosis, again very important. This is peripheral. Skeleton, butterfly vertebrae, and renal variable anomalies, and vascular moya disease or aneurysm. So we have discussed that these things, these are very important, and just I am highlighting the important thing: paucity of intrahepatic bile ducts, posterior embryotoxin, peripheral pulmonary stenosis, butterfly vertebrae, and moya disease. These are very important point for Alagille syndrome. Basically, this is multi-systemic disorder. Okay, so we will discuss the this important systems that are involved in Alagille syndrome. Liver, as we have seen, this is intrahepatic. We have seen this is paucity of intrahepatic bile ducts that leads to cholestasis. So this we have seen. So this is sorted. Dysmorphic facies, this is important, and Alagille syndrome has been diagnosed by facies only in a low resource setting. So you see this is actually a broad forehead, deep set eyes, okay, then prominent ears prominent, straight nose and bulbous tip, and this is actually looks like triangular face. So this entity triangular face has been asked multiple times. So just remember triangular face. If you can remember the other facial features, that is good. But triangular face is pathognomic or characteristic of this Alagille syndrome. Congenital heart disease, as we seen earlier, this is peripheral pulmonary stenosis. Okay, other conditions are seen, but peripheral pulmonary stenosis is important. Butterfly vertebra in skeleton disorder, which is important. Other are hemivertebrae or spina bifida occulta. In eye, posterior embryo toxin. Actually, anterior chamber defect. What is posterior embryo toxin? This is important, has been asked once. This is actually prominence of Schwalbe ring at the junction of iris and cornea. Just remember this. Okay. So again, we are seeing posterior embryotoxin. We have seen this. This is important. This is as again we are seeing this is ring between. We have seen junction of iris and cornea. This is iris and cornea junction. Ring posterior embryotoxin. Butterfly vertebrae. This is important. Butterfly vertebrae. As we can see, we will see this is butterfly vertebrae. Okay, so this looks like butterfly. Okay, facial features we have discussed like triangular faces and prominent forehead, deep set eyes, bulbous nose and pointed chin. Again, the important point, this is caused by JAG1 gene and NOS2 gene. The most important is this gene, GAG1, which is 98%. Other genes, just remember the name, they can be asked KDM6A gene, HNF1 beta gene, but important gene will remain JAG1 gene and NOTCH2 gene, which the main gene is JAG1 gene. Okay, then how you will clinically diagnose this Alagille syndrome? Based on presence of cholestatic liver disease. Basically, the neonate presented with the neonatal cholestasis and you found the other anomalies associated with like ophthalmological examination, posterior hydrotoxin as we discussed, cardiac peripheral pulmonary stenosis, skeleton, butterfly vertebrae and facial dysmorphism. That's fine. Okay, if you do liver biopsy, that is very, very important. If you do liver biopsy, paucity of intrahepatic bile ducts, which is defined by bile duct to hepatic artery ratio less than 0.5 in portal area, seen in 75 to 100% of cases. Basically, bile duct hepatic artery ratio is less than 0.5 per zero point 0.5, which is important, and this is 75 to 100% cases of this cholestatic liver disease liver biopsy we can see. So this is pathognomic of Alagille syndrome. The point here to be noted that newborn, the bile duct paucity may not be present and liver biopsy may be normal. This is again pitfall in newborn. Misdiagnosis of biliary atresia can occur. That is the common thing. Okay, age of diagnosis. The majority cases are diagnosed within first year of life itself, and the important thing, cholestasis worsen until 5 to 6 years of age, then stabilize or improves in some cases. So worsen till 5 to 6 years of age. And the important thing, the pruritus is a prominent and debilitating condition noted within first 6 months of life. The treatment is also there for pruritus Alagille syndrome. So this is important part. So management, like you have to do traditional treatment like bile acid flow. You will increase in cholerectics, rifampicin, sertraline, and naltrexone. Newer options which are actually included in this new edition of Nelson, like apical sodium dependent bile acid transporter inhibitors. Just remember these two drugs name, that is maralixibat and odevixibat. Just remember, I'm just highlighting these two important drugs. These drugs, what they do, they reduce pruritus and serum bile acid level. These drugs are very, very important. What are the other complications which can occur, like liver disease and stage liver disease can occur, and cardiac and vascular complication can occur. So this is Alagille syndrome for you. We'll meet in another video of this amazing series of NEET SS pediatric series for the upcoming interesting video. Till then, stay tuned and do like, share and subscribe.